So my name's Melissa Williams. I'm a medical oncologist. There's many types of oncologists: surgery, radiation, medical, pathologic. There's several of us. So my role in terms of patients with cancer is really to think about the body as a whole, because the treatments that we often need to give patients, chemotherapy, medications, pills, obviously affect the body as a whole. And so that's my little niche here. And I've known Jen for a long time because of a patient of mine back in 2009, 10, who was on chemotherapy and not getting neuropathy, and it didn't make any sense because it was like 2 years going. And I'm like, are you sure? Are you sure? And I kept asking her because I felt like it was time for me to give her a break from her treatment or reduce her dose. And she said, no, I don't have any neuropathy. And then finally it all came out that her little secret was, this type of exercise that she was doing through her fitness expert. And it was just astounding. And eventually I got to meet Jen and have become part of the Cancer Champion community. So when I pulled up her email a couple months ago with the kind of invitation to be here tonight, I looked at the date in my calendar. I thought, oh my gosh, I'm going to have to tell Jen I can't make it because I'm on call and I have a couple other commitments, and I'm up to about 80 patients a week as far as patients I see, plus the phone calls and everything that comes in. And I'm thinking, like, I don't know if you've met her, but how do you tell her no? Not this time. So I'm formulating how I can tell her, and I know she'll always understand because she knows, at the end of the day, we're here to take care of people. And literally that same afternoon, I was in clinic, and a patient of mine who had been finishing chemotherapy. And her backstory is she was young. I mean, we're all young, 70, 80s young, but she's extra young, so she was in her 30s, and she has a child at home with autism, and she has a son and a toddler, younger sister, and she'd been through chemotherapy and was tough because, especially in this day and age with the concern for COVID, people who are immunosuppressed coming home to a child with special needs and still trying to work and do all of these things and unable to lift her arm to where it needs to be in order to move on to the next step of her treatment, which is radiation. And I walk into the room and she says, the first thing I want to do is thank you for referring me to Cancer Champions. And I was like, oh, now I gotta go. I have to go to that event. Because really what struck me is that I couldn't afford not to go. Because this is exactly what my patients need. And it's what I don't have the training to do. So what's really unique about Cancer Champions is, I think, three things. One is that, and I don't think Jen said this because she's probably too modest, there is not another platform like this, period. It just doesn't exist. So you could find, online exercise videos through, Peloton or Beachbody Fitness or whatever. You can find online nutrition programs. You could find an online meditation coach. You can't find that all under one umbrella specifically for cancer patients and with a cancer certified exercise specialist. It literally doesn't exist, and that's why she has patients not just here in our community. We just happen to be lucky that this is kind of where it all started, but she and Cancer Champion coaches and Cancer Champion experts see people all over the U.S. and all over the world, right?
Yes.
Yeah.
Yes.
So it's that point I think is really important to hit home. That it's an incredibly unique platform. It is a three-prong approach, and it involves exercise, it involves nutrition, and it involves mind-body connection, and all within the context of where a patient is, what they need. And what I was thinking about this because I thought, well, gosh, exercise, like the human body, cancer, like I understand the human body, I understand the medical side of that, but nowhere in medical school did I ever learn anything about exercise or physical therapy, or we just never got that. And then I was thinking about the next step, which is the nutrition piece. Sure, can you explain glycolysis and the breakdown of sugars? Yeah, but we never had a nutrition class. Did you ever get nutrition in medical? We literally never had a nutrition class. So when people ask me things like, how much vitamin D should I take? I got to pull up the literature and figure it out myself, So I need these experts. Same with mind-body connection. I mean, sure, we take psychiatry and we learn a little bit about medications, but we really, again, therapy, no, nothing about mental health. We don't really study that in medical school. So those are three things I just don't have the expertise for. And it is just a game changer for me to be able to have a platform where I can offer that to my patients. So within the context of bringing those three things together, some patients want all three, some patients don't. But I think the other thing that's really unique about this program dawned on me when I was at wasn't it like Neighborhood Night Out last week? I was at Neighborhood Night Out and I met a new neighbor of mine, and she works in education at the university, and she was talking to me about her specialty being that growth mindset. Has anybody heard of that here? Yeah. So I remember hearing about this when my kid was in elementary school, and it's really helpful, because kids who just look at the big problem in front of them and get frustrated and just want to shut down and not move on is common, right? And so it's a way to help teachers or educators or a frustrated mom to talk to their kid about, you don't have to shut down when you see this complicated program or problem in front of you if you can switch your psychology to having a growth mindset. And I'm not going to be able to describe this in appropriate terms as an educator could, but what I thought of immediately, because I was thinking about this event, was that I think is what Cancer Champions gives to patients, because it is so hard the day you're diagnosed with cancer and set down that journey to have your growth mindset all by yourself. And I think this is a really good example of a growth mindset where patients can start their journey maybe not feeling like they want to, whether it's nutrition, conditioning, or mental health, but come out on the other side having grown through the support of the Cancer Champions community. So, what's that number?
638. 49,000 plus.
49,589, right?
589.
Something like
that.
Yeah.
49,589. So I calculated that because there are 18 million, a little over 18 million people with cancer every day, or I'm sorry, every year. 18.1 million people every year are diagnosed with cancer. And so I was doing that little calculation because that is actually the number of people, 49,589 people in the next 24 hours will be given a diagnosis of cancer. So that, from how they are doing right now, today, compared to 24 hours from now when they get that diagnosis, is going to be a big change. So what can we do to help them? I think the lucky hundreds or thousands of people that would have access to something like Cancer Champions can come out of that shock and start to feel better through, of course, a network of many resources. But one of those resources could be Cancer Champions. That's all I have to say.
Well done.